Thank you all for joining us here today at Brigham and Women's Hospital, one of the most respected and renowned hospitals in the world, actually. My name is Brian Perkins. I'm an attorney with the law firm of Piper, Wolf, Kane, Carr, Conway, and Wise, Piper Wolf for short. As you all know, we're here today because of the shocking and disturbing actions of Dr. Derrick Todd, a Brigham rheumatologist who sexually assaulted Mimi and over 100 other patients. For those of you who aren't familiar, rheumatologists are often referred to as arthritis doctors. But Dr. Derrick Todd is a dangerous predator. He used his position of trust and authority as a doctor with Brigham and Women's to aggressively groom and coerce his patients into breast and vaginal exams that were medically unnecessary and well outside the scope of the care that he was there to provide for his patients. These exams were not medical exams at all. They were blatant, aggressive sexual assaults. Dr. Todd touched, groped, fondled, and sexually assaulted his patients while making inappropriate sexual comments to them. Dr. Todd thought the grooming and power he had over his patients would keep them silent forever, but he now knows his patients are not victims, they're survivors. They have a voice, and they are coming forward to share their story. Today we filed a major lawsuit on behalf of Mimi, who you'll hear from shortly. And it's against the sexual predator, Dr. Derrick Todd, and against Brigham and Women's Hospital for failing to protect its patients. It's unfathomable that a doctor would use his position of trust to prey on the patients that he was trusted to treat. And what's even more stunning is that this could happen at a world-renowned hospital like Brigham. We're here today to send a clear message to Dr. Todd, to Brigham and Women's Hospital, and the world that this will not be tolerated. We demand change so this can never happen again. Next, you'll hear from Mimi. She's going to share her story, but she's not just speaking up for herself, she's speaking up for women everywhere who suffer sexual abuse in silence. But first, I want to say just how proud I am of Mimi. She's shown incredible strength throughout this difficult process and in the face of betrayal. I also want to say how sorry we are that our health care system let you down. As it takes a lot of guts and bravery to come forward and tell your story like this, and I'm honored and humbled to introduce you to Mimi DiTrani.
Thank you. Thank you all for being here. Step up. Thank you all for being here today. I also would like to acknowledge Brigham and thank them for reaching out and offering mental and trauma support. I think that if you have been a victim of this doctor or others, you should take advantage of that resource or others. I want to thank the Framingham and the Boston sex crime detectives. They're working very, very hard with integrity and dignity to make sure that these actions don't go unacknowledged. I'm also here today because when you trust someone to help you, you see them and you're very vulnerable, and when they violate that trust, excuse me, and they hurt you instead of heal you, it can be very frightening and not easy to process. But I want everyone listening here today that there is safety in numbers. Nature, birds, dolphins, they have taught us that. So therefore, without sounding cliche, you are not alone. There are safety in numbers, and you can speak out. You don't need to be afraid to speak your truth. You deserve not just my voice, but your own voice, and you have earned the right to be healed. Elie Wiesel wrote, "I swore never to be silent when humans endure suffering and humiliation. We must always take sides." My being here is not for vengeance. It is about taking a side so that those in power cannot continue to abuse under a guise of deception. I want to, another quote from Academy Award-winning screenwriter Akiva Goldsman that I think is very important. "Trauma is the closest thing we have to time travel. It doesn't fade over time. Memory remains like rot beneath the bark of a tree. It will invade all of our experiences of life until trauma makes our world unlivable. That is why I urge you to seek help. I've spoken with RAIN, and they're very aware of this case, and anyone can call their hotline and speak to them as well as the hospital. Here's the phenomenon, to continue the quote. Victims of abuse often survive, yet are abused by someone else. This is why I'm, again, encouraging you to speak out and seek help now. Predators are very adept at finding their prey. They are picking up on cues that nobody else, even ourselves, cannot see. And this thing I cannot emphasize enough. None of this is in the victim's control. None of this is the victim's fault. Nothing that has happened to myself or to any of you listening is your fault. And I wish you all the best from the bottom of my heart. Thank you.
Thank you. Very briefly, I first want to say thank you to Mimi for her courage. I am so proud of you for coming here with the goal of helping others in a similar position. My name is Paula Bliss. My name is Paula Bliss, and I'm a partner with the law firm of the Justice Law Collaborative, and I'm here with my partner, Kim Doherty. Our firm has for years represented survivors of assault, and because of that, I know how difficult this was for Mimi to get up here and speak her truth while encouraging all of the other survivors out there who may be struggling with their trauma. This abuse perpetrated by this most trusted facility and most trusted doctors is absolutely disgusting. We put our faith in our doctors. Patients trust their doctors. They come forward and they're in their most vulnerable positions, and they trust their doctors to treat them with their lives. And they are simply devastated, and they are incredibly, their trust has just been broken. By speaking out, Mimi and all of the other survivors are helping to keep these predators away from women. We've seen all too well the strength and power of a survivor sharing her story is almost impossible to describe, because that voice quickly becomes a chorus. And that chorus can hold a doctor and an institution, an entire medical facility, accountable for these wrongs. Because it's this empowered chorus of survivors who will affect actual change and hold these wrongdoers accountable, these women will have justice. The healing begins today. Thank you very much. We welcome questions. If anyone has some questions for us.
Mimi, just a question for Mimi. We got the chance to read the complaint, and it seems like you didn't understand that what was happening to you was wrong in the beginning. Can you talk about the moment when you realized that this was not right?
Excuse me? I didn't hear the last part
Yeah,
of your
can you
question.
just talk about the moment you realized that what was being done in your appointments was not right?
Yes, I did ask him about it. I went to him. He is a specialist in very rare autoimmune rheumatological conditions, which I have. And he wasn't performing MRIs on my bones, and I was suffering in pain, but he was insisting upon continual gynecological exams. I did email him. I did call him out on it, and I was furious. And that is when he told me he was quitting to spend time with his family. And I didn't believe that. I moved here to be under his care. So I did call the hospital, the medical board, to ask if there was something else going on. They said, yes, we can't talk about it. I gave him an opportunity. Actually, I've given him several opportunities. I've called him. I said, if you tell me the truth, maybe I can help you talk it out. I don't know, But he maintained his mendacious story, and I never saw him again.
But you still heard from him. The complaint says he texts you, calls you.
Not since then, and I said, I cannot help you anymore.
Why are you coming forward? Why are you speaking for him?
I've spoken to several of his patients. They're scared. They don't understand.
I want to say they're doing a nice job because I'm at Brigham and Women's Hospital.
They're scared. They feel like they may have to face him. They're ashamed.
They're doing a good job.
I want them to know that there are resources available to them. They can be protected by this group or others, and under anonymity. They don't have to see him. They don't have to face him. And I want them to know that they can get the support that they need. And they can actually find a new doctor, which is something I've begged for months since he quit. And I want them to feel like someone is here willing to show their face, so they don't have to, but they can still, reach out and get the help that they need.
You moved here for this doctor, you said. You go to him for a treatment that you said was extremely debilitating. When you realized that trust was broken, can you kind of walk us through how you were feeling?
I questioned it because I thought maybe I imagined it, and it's a doctor. It's not as if it's I've worked in the entertainment industry. I've seen the face of this, but he always had an answer. He's very charming. He's very personable. He befriends you. He makes you feel he cares. I've heard this from other patients. This is why they questioned it. They had a hunch as well. And I asked, and then finally, he had someone in the room the last time I saw him, which made me feel a little bit more comfortable. But it was very difficult for me to find a specialist in my disease. And this is one of the best hospitals in the world. And he and I had a very comprehensive healthcare plan laid out before I made the journey. And it didn't pan out.
I think that's one of the big key elements of this case. When you have a doctor who's treating patients who need really specialized comprehensive care, they're trusted, they're wearing the lab coat from this hospital, and then they continually press boundaries. A predator like this who's in the power of trust from a doctor is one of the most dangerous people, because they can push boundaries and do it under the guise of, this is continued medical care, trust me. Maybe we're helping in some other areas of her treatment, but pressing those boundaries. And I think through this investigation that the police are conducting and that we're going to be conducting with other survivors, we're going to learn more about exactly how this worked. It's really dangerous when a predator has somebody in an examination room in a vulnerable state seeking help for a really important medical condition, and then presses a boundary, and it leaves the patient in a confused state. Why is he doing this? What am I supposed to do at this stage? Do I call out a doctor? I'm supposed to listen to my doctor. That's what you're supposed to do. Follow your doctor's advice. Make all the follow-up appointments. Take the medication as prescribed. So this is the ultimate betrayal, when a patient has to be forced to sit there and question a doctor's treatment and try to find out what is actually going on here. And the truth is coming out now, and we hope that this case will serve to help a hospital like this and other hospitals around the country set up systems and procedures so that something like this never happens again.
The press release mentioned something about possibly more than 100 people. Where'd you get that number from?
I think the investigation is ongoing right now. There's a lot to be revealed. We're still really early on, but I believe that we have a strong belief that it's going to be a very high number.
He's been practicing for years, so we understand that and it takes a long time to groom patients. These predators are incredibly adept at grooming and pushing boundaries, as Brian said. So we believe that there are dozens, if not hundreds, of other survivors out there.
We know of at least 32 patients who have at least hired attorneys. So to know that there's at least 32 people, how does it make you feel to realize just the enormity of this abuse?
I'm horrified, and that is why I'm here today, because I know there's more. And I feel, of course, I thought the question of why would I go back is an excellent question. And I think a lot of the girls, women that I've spoken to have asked themselves that very same question. I had a hunch. Why did I go back? But that's why I want to say it's not your fault. These people know what they're doing. They know how to make you trust them. I'm the only one that can prescribe you this or treat this. And so you think maybe I imagined it. You want to believe, I mean, especially of a doctor. We've seen this in the workplace. We've seen this in politics. We've seen this all over, right? But for me personally, I would never have imagined a doctor. Never. So that is why I'm here. If there's 32, I know there's more, and I want them to know it's going to be okay. And he deserves to be held accountable, unfortunately.
Brigham and Women's. Why do you believe the hospital is at fault?
Well, this should never happen at a hospital. This should be impossible to happen. It should be impossible that a doctor is conducting gynecological examinations without a chaperone in the room. How is that possible? Somehow that the hospital has failed on multiple levels. How is he?
And I called them and I emailed him on a site, on an email that's monitored by them. Why are you doing these exams? And when I actually told them that I made several complaints and they didn't respond, they did apologize and offer me a social worker, but they did nothing about it. So I don't understand. These guys would probably be better, suited to answer that question, but they should, I would imagine, be monitoring their staff just like any corporation.
And this is the very early stages of the investigation, both criminally and civilly. He's been practicing, as I said, for years. Obviously, we know of 32, at least right now. Many more in the wings. Hopefully they will come forward and speak their truth as well. But he's been practicing here for years. There's no reason to believe that Brigham and Women didn't have some sorts of red flags with respect to this physician.
And there has to be a way to identify predators like this. Because you got to think about this situation. This is a serial predator who is sitting in a hospital, and women who need help are just being brought to him and being put in an examination room with nobody else. It's one of the most dangerous situations you could ever encounter for a serial predator, and that's why the numbers are probably going to be so staggering and it's so shocking now. But the hospital has responsibility for this. It happened under their roof by one of their doctors with their own patients, and they deserve to be protected.
Do you think there was any aspects of a cover-up here?
I think the investigation's still ongoing for
Yes,
that, and there should be a lot
absolutely.
more to be revealed.
If there are any other further questions, we do have a room at the inn at the Longwood. But we're going to stop this now and head on over there. Okay?
Thanks to all of you for being here.
Thank you all.
Mimi, can you pronounce your last name for us so we say it correctly?
Yes,
into the microphone?
DiTrani.
Can you say it close to the microphone?
DiTrani?
And Mimi, M-I-M-I?
Yes, ma'am.
Thank you.
Thank you all.
Thank you.
Thank you, everyone.